I'm Dr. Spindell, and welcome to our Laser Vision Correction Seminar. A lot of you have been waiting for years to maybe consider LASIK for yourself and kind of hoping that I'll wait till it gets better, I'll wait till they work out all the bugs, and I'll wait till my neighbor to have it and my uncle to have it and things like that. And the reason why we're giving the seminar tonight is that Dr. Bazan and myself, we really feel that LASIK has now approached a point with new technology where it really truly is a safe and predictable procedure. So I want to introduce my partner, Dr. David Bazan, who's a very experienced LASIK surgeon and has a lot. He'll be doing the laser seminar tonight. I'll be here also if you have questions. So thank you. Dr. Bazan.
Thank you. Thanks, Jerry.
Thanks.
So we're going to talk about a number of things, not only just LASIK, but about the practice, about ourselves, about the technologies we use, about some of the other surgeries we offer too. Some of you may not be candidates for LASIK after all, so we'll also discuss cataract surgery and some of the newer technologies that go along with that. We're going to get started and just talk about the practice a little bit. This is a comprehensive eye care practice, which entails a number of different fields of ophthalmology and optometry. We specialize in LASIK and cataract surgery. Obviously, we're going to be focusing on LASIK today, but cataract surgery also has a number of new technologies that we've been implementing recently. For example, there's a multifocal lens that's now available for implant inside of the eye. This lens offers patients the opportunity to not only see well in the distance, but also up close. It's a technology that wasn't available until recently. Prior to this, patients relied on reading glasses for anything that was up at within arm's reach of their viewing distance. So again, this is something that can be offered as an alternative to LASIK for patients that are not candidates due to the presence of cataracts. We do a number of medical eye exams here. We focus on diabetes, macular degeneration, glaucoma, just to name a few different common pathologies. We also do a number of routine eye exams through our optometrists. This obviously entails glasses and contact lens updates. We use retina specialists from the Leahy Clinic to address some of our more advanced cases of retinal pathology. And we also have a plastic specialist who deals with Botox injections, eyelid procedures such as blepharoplasty, and fillers such as Juvederm and Radiesse. We offer same-day emergencies and walk-ins, which are always available, and we have a 24-hour doctor on call. So anytime there are any emergencies, there's no reason to go into the emergency room and wait several hours. We have somebody that can deal with you and open up the office if that's necessary. We obviously have our Derry location here. There's also a Londonderry location, and we're going to have a new office in Wyndham coming in the spring. And this is actually our 30th anniversary year, so we've been around for a while serving the community. So a brief synopsis or summary of how we approach vision. We don't view eyesight as a luxury. It's a fundamental, invaluable function in your life, and you use it every day. This is why we strive to provide you with the most advanced and safest LASIK technology. So Spindell Eye has performed LASIK surgery since the earliest stages of the procedure. In fact, we were involved in the early investigative procedures with the FDA as a primary investigator. This was back in the early 90s. The practice has acquired over 20 years of expertise that began in 1992, and we've had thousands of eyes worth of surgical experience. We employ the most current advanced laser technologies, which are the intralace femtosecond laser and the wave-light excimer lasers, both of which I'll go into in more detail in a little bit. And this ensures the most precise results. They're the safest procedures and with the fewest side effects as well. And again, I'll go into some of the technical details on why these are the appropriate technologies to use. One of the advantages to using this practice versus other LASIK providers is that technology varies greatly. Different offices and providers and surgeons use different platforms for technology, and many practices still depend on older, less reliable, and more risky treatment platforms and instrumentation. Spindell Eyes always led the way in technological advances in ophthalmology and eye care. To give you a couple examples, we've been employing the OptoMap map, which is an ultra-wide field image that can be taken of the retina through the non-dilated pupil. So this offers patients a convenience factor in the sense that they don't have to be dilated every time they come in for their exams. We've been using something called OCT, which is an optical scan of the retina as well as the optic nerve. This is used to diagnose a very subtle and advanced glaucoma or macular degeneration in addition to other pathologies. And finally, the Pentacam is one of our newest tools, and that's actually a vital instrument in the process of determining who is a good LASIK candidate. The Pentacam again, gives us a layer of technology and interpretation that can really either rule in or rule out people that would otherwise be poor candidates or good candidates, depending on the data that it collects. This is something that not a lot of offices have, and it's a very important tool to making sure that you have the safest procedure and the safest surgery when it comes to refractive surgery. We approach our LASIK surgery with the same cutting-edge approach that to ensure the best possible vision, the safest outcomes for our patients, as we do with all other aspects of the technology we implement here. So why should we choose blade-free, otherwise known as all-laser LASIK? For one, glasses and contacts are a hassle. You have to update them every year. You have to get refills. They're expensive, too. The glasses, the frames alone can be hundreds of dollars. They're inconvenient. The glasses fog up during workouts, sports, it's difficult to play when you have a pair of glasses on, and outdoor activities can be tough as well when you're fumbling with a pair of glasses. Cosmesis, there are cosmetic reasons for going after LASIK. Contacts oftentimes elicit an allergic response in the eyes, which can result in chronically red eyes or irritated eyes. So providing LASIK is a good way to avoid some of these cosmetic deficits. Waking up with clear vision is something that all of our LASIK patients appreciate afterwards. Waking up in the middle of the night and seeing the digital clock clearly next to you, being able to go to the bathroom in the middle of the night without fumbling for your glasses and finding out where they are. Safety in case of emergency. When you're overseas, if you break your glasses or you rip your last pair of contacts, obtaining something at the last minute, getting an exam and actually acquiring a pair of glasses can be difficult, so this precludes that. You get the full range of vision with LASIK. With nearsighted patients, oftentimes they can only see up close. They need glasses for distance. So to get that whole range, you really need some sort of surgery for that. And finally, like I said, savings. Glasses and contacts cost a lot of money. Over the long term, you're going to spend more on a pair of glasses each year and contact updates each year than you will on the one-time LASIK. So to briefly go over some of the what we call refractive errors that can be treated with LASIK, I'll start with myopia, or what's otherwise known as nearsightedness. In this condition, the cornea is focusing the image onto a point in front of the retina. This causes distant vision to be blurry. Up close is often clear within a certain distance, depending on the amount of error. The next error that we correct is hyperopia, or farsightedness. These individuals often have trouble seeing up close. Their distance vision can oftentimes be a little bit better, but even that, depending on the severity of it, may require prescription glasses as well. And finally, astigmatism. The curvature of the cornea causes two separate images to be located in two different locations. This causes blurry vision at both distance and near. So LASIK can address any one of these conditions. It obviously has its limits. There are certain amounts of correction that we cannot do. But with the latest technology out there, with the latest lasers that we're using, that range of correction has been broadened. Many more people are now candidates that were not candidates years ago. LASIK stands for laser-assisted in situ keratomileusis. Like I said, it corrects nearsightedness, farsightedness, and astigmatism. It does this by reshaping the cornea with the laser technology, and it's an outpatient procedure that uses a topical anesthetic, meaning an eye drop to numb the eye. There are no injections, no IVs. It's a very clean procedure. The steps for the LASIK procedure include a pre-op consultation. As we mentioned today, we can do a brief pre-op consultation here where we measure the thickness of your cornea and look at the curvature to determine if you're a good candidate, as well as looking at your prescription glasses. This helps determine the range of your probable outcomes based on your particular prescription, your eye health, and your expectations. Speaking of eye health, this is something that we take very seriously. If we find anything that indicates that you may not be a good candidate candidate for LASIK, we don't proceed with it. We want our patients to have the best vision, but we're not going to put you at undue risk. For example, if there's dryness in the eyes, we're not going to treat you until that's been stabilized. LASIK in some cases can exacerbate dryness. Some surgeons take this cavalierly. They don't treat it as seriously as it needs to be, but this can cause complications if you don't address it appropriately. Like I said, we recommend the best procedure for you based on these results. The procedure is the next part. It takes approximately 30 minutes, 20 to 30 minutes. The laser time is the briefest portion of that. Most of what we're doing is moving you from one laser to the next, positioning your eye, and making sure everything is where it should be. In general, you should set aside about 2 hours from start to finish. That's actually probably a little overstated. It's probably more like an hour, hour and a half. And then there's post-op care. You'll follow up in our office with a number of visits, the day after surgery, week after surgery, 1 month after surgery, and you'll use post-operative eye drops to help with the healing process. So to briefly go over the procedure, like I said, your eyes will be anesthetized with numbing drops to make you comfortable. You really shouldn't feel any pain or discomfort during LASIK. The most common sensation is pressure, occasionally some cold water as the eye is being rinsed from time to time. Step one involves creating and gently folding back a corneal flap, a partial thickness corneal flap, which you see in the first image here. That's used with the Intralase femtosecond laser, so there's no blade, no knives involved. Step two, we reshape the cornea using our Wavelight excimer laser. And step three, the flap is returned to the original position and sealed into place. With the Intralase laser, we can now cut square edges that fit perfectly when we bring the corneal flap back down. This wasn't the case, and this isn't the case with some of the mechanical instruments that were and are still being used by some surgeons. So it's a much more reliable procedure. You can reproduce the results time and time again, and you can give the patient a very confident expectation of what their vision will be afterwards based on this. So blade-free LASIK, as we were just talking about, is an all-laser approach to creating the corneal flap. We use the Intralase femtosecond laser. Through tiny rapid pulses of cool laser light, it creates this partial thickness flap, and this is used instead of the microkeratome. The microkeratome is an older technology that produced a flap using a blade, a surgical blade. This was much more prone to complications. You can look up on YouTube to see some of the disasters that have occurred with this type of procedure in the past. With the Intralase laser that we're using, like I said, it's a much safer procedure for the eye, much more comfortable for the patient. Healing time is shortened. Comfort after the procedure is much better than it was with some of the older technologies. So the Intralase laser works by first inputting the specific depth and position that we want the laser to operate at. The laser moves back and forth across the eye, creating a uniform layer of thousands of tiny microscopic bubbles. These pictures kind of represent that. And this happens at a very rapid speed. It takes about 20 seconds to create the flap. So like I said, these aspects of the procedure are the shortest duration. Most of what we're doing is positioning the eye and getting you into the right spot. The corneal flap is then folded back to perform the LASIK procedure, and this is where the excimer laser comes in. This is a different type of laser called the Wavelight laser. So between the flap cutting and this laser, the bed is moving back and forth between the two, and you're in one position just waiting for the procedure to occur. The LASIK procedure is completed when the flap is repositioned on its beveled edge, and that's represented by this little diagram down here. You can see the square edges. This is very similar to what the Intralase laser produces. Because of those squared beveled edges, it seals down very nicely and makes for a very stable flap afterwards, reducing the risk for complications, movement of the flap afterwards, and issues like that. Again, just to reiterate, the Intralase laser is a very reliable procedure. It creates a uniform thickness flap, which was not true for some of our older lasers and older technologies. It's programmable. It creates perfectly round flaps. It doesn't get any more precise than this. So this is a video of the Intralase in action with a little information about the laser in general. So I'll just fire this up and let you guys take a look.
LASIK. Most of us have heard of this unique vision correction surgery that has given millions of people freedom from glasses and contacts. But what you might not have heard of is the revolutionary technology from Intralaser, a new tool that now enables our surgeon to provide you with even better vision. Vision that is far more predictable with technology that is uniquely safe and precise. And since we are dedicated to providing you with the best vision possible, our office is now equipped with Intralaser. Better technology, better results, better vision. Since the introduction of LASIK, the procedure has always involved 2 steps, but until today has never been an all-laser procedure. Traditionally, a handheld mechanical device, essentially a surgical blade, was first used to create a thin flap of tissue on the front of the cornea. In the second step, this flap was then folded back, allowing surgeons to reshape the inner layer of the cornea using a laser beam. The flap was then returned to its original position. Complications of the procedure are rare, but most of the complications that have occurred have been directly related to how precisely and uniformly the initial flap was created. Well, exactly how does the Intralaser technology help us provide you with this uniquely safe, uniquely precise approach to predictably better vision? The difference today is that we use Intralaser's advanced laser technology in the first step of the procedure, rather than the traditional mechanical handheld bladed device. The Intralaser technology provides a less invasive approach that uses a computer-controlled laser rather than the handheld bladed device. This enables our surgeon to safely create a corneal flap of exact shape and thickness. The benefit to you? Better vision, and a new sense of assurance that comes from this unprecedented level of safety and precision. So, if you've been considering laser vision correction surgery, your timing couldn't be better. Better technology, better results, better vision. With Intralaser, we're making every procedure better.
So that gave you a pretty good idea of what the older technology looked like with that blade going across. We were just reviewing this before you guys came, and seeing that, it looks almost primitive to see that blade going across the cornea like that. It almost sends chills down your spine. Compared to the newer technology, it's just, worlds apart. So the benefits to the blade-free LASIK are greater comfort, better vision. More patients achieve 20/20 vision or better with this laser technology compared to our older technologies. It's safer, like we said, it's programmable settings, it's extremely precise. It's a customized procedure. We can input data to tailor it to your eye, and it's patient preferred. In studies that were completed, the vision of the Intralaser treated eye was preferred 3-to-1. Another aspect to this, we keep harping on the Intralaser, but another important aspect to the technology we use is the wave-light laser. The Intralaser cuts the flap, and that's obviously very important, but then the laser that actually sculpts the cornea or reshapes the cornea is just as important. And this wave-light laser that we use offers a tremendous advantage over some of the older technologies that were used. The older is called an excimer laser. The older excimer lasers ablated the cornea in one specific area, about a 6.5 millimeter area in the center of the cornea. Outside of that, there was no treatment. So if your pupil enlarged, for example, at nighttime beyond that zone, halos and glare became a very big problem, and this was one of the biggest complaints with some of those older lasers. With the wave-light laser, it creates a transitional zone between the centrally ablated area and the tissue that's not treated. So it kind of smooths out that zone to reduce halos, reduce glare, and make nighttime vision better. You can see kind of an example of what many people contended with after LASIK, older LASIK, in the middle photo with the rings around the headlights and the starbursts. So like any surgical procedure, there are elements of risk. The possible side effects of LASIK include dryness, nighttime glare, light sensitivity, mild irritation, and over or under correction. Most side effects are temporary and will subside within 1 to 3 days. Patients are often concerned about the potential loss of vision. Our practice has never had a case of this. In terms of the affordability, obviously different patients have different needs. We have several payment options, one of which is Care Credit. This is a financing agency that will allow you to pay monthly according to a payment plan. If your credit score is high enough, they'll actually give it to you interest-free as long as you keep up with the payments. Flexible spending accounts can be used, credit cards, cash check, and some insurance plans may cover it. If your insurance plan does, we recommend you contact them. They will have to reimburse you separately from our financial payment. Let's see, what do we got next? Our practice results. This is actually very important to know. Knowing a doctor's success rate is vital to making a well-informed decision about LASIK, and I would beware of any physician who's unwilling to openly discuss his or her results. In our practice, since we've instituted the Intralace and Wavelight lasers, our success rate has been 96%. That is, 96% of the postoperative patients have achieved 20/25 vision or better without glasses or contacts. So what if you don't qualify for LASIK? In some patients, their cornea is too thin or they have unusually shaped cornea. There is an alternative to that called PRK. There's also an alternative for people that are hyperopic or farsighted. For individuals that are looking for reading power, there's a technology called conductive keratoplasty, or CK. This uses a radio frequency to reshape the cornea. So to kind of go through some common questions and answers, I'll just kind of go through the most important ones here. How long does the procedure take? It's 20 to 30 minutes. The laser itself, cutting the flap, is about 20 seconds. The treatment with the excimer laser can range anywhere from a few seconds to 15, 20 seconds, depending on what your prescription is. You'll probably be in the surgery center for an hour, hour and a half. Wearing contacts, we usually recommend that patients stay out of their contacts for at least a week if they're a soft contact lens wearer. If they're a rigid contact lens wearer, they have to stay out for even longer than that. Will you feel anything? As we mentioned, no. You have topical anesthesia. You'll feel pressure, maybe some cool water. That's about the worst of it. It's a very comfortable procedure. Any restrictions after surgery? Common sense with the flap. You want to make sure you're not rubbing the eye, that you're not going to be involved in any contact sports or activities where you could potentially disrupt the flap. We recommend that you stay out of water for 4 weeks after the surgery, so be very careful when you're bathing. No swimming during that time period. Follow-up appointments are generally 1 day after surgery, 1 week, and 1 month. We then often see our patients 3 months, 6 months, and 1 year out to see how they're doing as well. Most of our patients can return to work about 48 hours after the procedure. Many people are concerned about their reading vision up close. They're told that they'll still need to wear reading glasses even if they have the LASIK done. Why is this? This is a condition called presbyopia. With bifocals, you have essentially two prescriptions, one for distance at the top of the lens and one for reading at the bottom of the lens. LASIK can correct one of those two things. In general, people choose to have their distance vision corrected. This will still require reading glasses for up close due to natural changes that occur in the lens after the age of 40. For dryness, we have several testing methods that we use. Again, we will aggressively look into dry eye symptoms to make sure that the appropriate candidates are chosen. Like we said, safety comes first. We want to make sure that we're choosing the right people for this procedure and that we're not harming the eyes in any way. If you develop dry eyes after surgery, what can be done? Artificial tears are certainly one option. There are prescription eye drops such as Restasis that can also be used, and we have other techniques as well to help with chronically dry eyes, so there are ways to treat this afterwards. If I have glare after surgery, can that be treated? There are several options for that. This is much less of a problem than it used to be. The patients that do experience any glare after surgery generally neuroadapt to it. The brain kind of gets used to seeing it and then they tune it out over time. This usually occurs after a few weeks to a few months. For patients that continue to see glare even after that, there are anti-glare glasses that can be worn. These would be prescription-free in all likelihood, but have the coating on it to reduce any glare from headlights and streetlights. And finally, in more advanced cases, you can even use mild constricting drops to reduce the size of the pupil so that glare is minimized. Can I have too large pupils to have the procedure done? In the past, that was a big concern, and it still is a concern. There are limits to what we can treat in terms of pupil size, but as I said, using the Wavelight technology is much less of an issue than it used to be. LASIK is often not covered by insurance, but we recommend you follow up with your insurer to find out about that. And of course, it is FDA approved. As I mentioned, we were involved in some of the first clinical trials with it. So I'll open up to any questions that you guys might have. Feel free to fire away.
After tonight, when we get the evaluation done, if we learn that we are a candidate, is there a grace period from tonight as to when we need to have the procedure done by?
No, this is really a screening process. You could come in a week from now or a year from now. It doesn't really matter. We may need to repeat some of the tests if you come in too far out, more than 6 months away. But no, this is a brief screening time. There'll be more extensive testing if you come back for a full preoperative workup. So there's no time limit on that. Yep, sure.
Actually, I'm kind of opposite of that. How soon? I mean, I've been like waiting for this. I went 10 years ago and they wouldn't do my eyes. And I know it's come a long way, so I'm hoping I'm a candidate. So if you say, yes, you are, how soon can the procedures be done? How long does the other testing take?
It can be done in a day. It takes a couple hours for all of that testing to be completed. Most of what you're doing is waiting for some of the dilating drops to work, because we do need to dilate you during the more extensive testing. Once that information is gathered, we can book you immediately. We operate once a month on the second Tuesday of each month. We have a number of cases back-to-back on those days. So as long as there are times available, we can do it.
October 7th.
Yeah, so our next date would be October 7th, the earliest.
November.
November then. Yeah.
Allergies, how does it affect it, like this time of the year? Hay fever with ragweed and goldenrod and all of that.
Well, you don't want to operate on an eye that's actively inflamed, so we would want to try to control that first. Allergies can oftentimes be coexisting with dryness in the eye too, so that's another thing to be concerned about. Sometimes allergic symptoms are confused for dry eye symptoms. So it's certainly something we need to control before going ahead with it. Having said that, if you have a history of allergies, it's not a contraindication to doing LASIK as long as we have it under good control. And that can occur through either topical medications or oral medications. Yeah.
Does this procedure need to be repeated after a number of years?
The eye is constantly changing. It's a dynamic organ like any other. You can have changes that occur over time. We don't really know who that's going to happen to. Having said that, most of our patients remain stable for many, many years. In many cases, patients don't need any changes until they have cataracts, at which point they're looking at a completely different procedure to correct that. So, to answer your question, yeah, in some cases, touch-ups need to be made in the long term, but that's a minority of cases, and maybe Jerry can speak to that more.
I've done thousands of cases over 20 years, and I'd say the number of people who have had to retreat is way less than 1% of those people.
But what is the average of average retreatment? Like, can you go 20 years? Can we expect, on average, to be able to go 10 or 20 years without having to have anything done?
My first LASIK patient from 1992 came in a few years ago and had it redone. But as I said, the vast majority of people, the second LASIK patient's a fireman in Derry, he's still not needed to have it done. Tiger Woods needed to have his redone. But the vast majority of people, if they're stable, there's really no way to say 20 years, but it's usually not needed to be redone. We try and wait for your prescription to stabilize. So if somebody's 19 or 20 years old and their eyes are getting worse every year, we won't do that, because why do that? It's going to change anyway. But once you get to usually into your mid-20s and things like that, your eyes have nearsightedness is pretty much stabilized, and people don't tend to get more nearsighted. So we feel comfortable. If you've had very little change in your prescription over the course of 2 years or so, 3 years, we feel comfortable going ahead with it. We really don't want to reoperate. Reoperating is harder than the first time, so we'd rather wait for you to be stable. But I think, if you're in your 30s or 40s, at this point you're probably stabilized and you're safe to go ahead, and probably don't count on having to have it redone, to be honest.
You had a question?
You mentioned you have a 96% success rate when you have 20/25 vision, and that obviously leaves 4% that is not successful. Can you describe what not successful is? That doesn't mean What does that mean? What does not successful mean?
Well, it could be a number of different things. For one, worse vision than 20/25. So there are some cases where people are either undercorrected or overcorrected and have a resulting vision of 20/30, 20/40. It's very rare that anybody has worse vision than that. It's minuscule in terms of a percentage. These are patients, some of whom are happy with a 20/30 vision. Some of these patients had very high prescriptions, and so the unpredictable nature of the treatment was exacerbated because of that. But because they had such a high prescription, some of them were completely content having 20/30 instead of 2400, which they had prior to the procedure. Some of those individuals did require retreatment. In those cases, it was usually due to thin corneas or some sort of abnormality on the corneal curvature that kind of put them in a little higher risk category for needing a second operation or enhancement. But generally, our guidelines for lack of success is vision. What is the quality of the vision?
So in your practice, worst case scenario is not quite great vision, not worst case scenario blindness, for example.
No.
Can I expand on that a little bit? So just to give you some statistics, when we started this 20 years ago, the enhancement rate, which is how many people did we have to take back and redo laser, which we do at no charge to you. It's all our expense if necessary. For the first year, we don't like to use the word guarantee, but if you don't get enough vision correction for what you need to function well, okay, which we used to call getting your driver's license, which is 20/40 vision, that was sort of our success. The technology's gotten better, so we've lowered the bar, I should raise the bar, I should say, to about 20/25, where people are happy with that vision. But we enhance people when they feel they're not seeing well enough. And what Dr. Bazan is saying, if you wear Coke bottle glasses, and we can get you down to where you can drive without glasses, but you may need something a little bit at night to help you on a night that's foggy or something like that, we consider that a success. We don't chase perfection because sometimes you can get into trouble with that. But going back to statistics, when we first started doing this, the enhancement rate was about 7%. Right now, with the technology that Dr. Bazan outlined, the enhancement rate is less than 1%. I think with this combination of LASIK, with the blade-free and the WaveLight, I may have enhanced one person in the last 2 years. It's just gotten so much better. But it obviously depends on being a good candidate, and we can talk about that. The other thing we do is part of your evaluation. It's a very extensive preoperative visit. It's going to be the best eye exam you've ever had in your life. And what we're looking for is anything there that's a clue that you may not have a good result. We don't want to do it. We don't. We've been here 30 years. We don't want to have unhappy patients. So we don't want to do it if you're not going to have a good result. We also want to make sure we leave room for an enhancement. In other words, there's a certain amount of correction we can do based on the thickness of your cornea, and we'll be measuring that tonight. And if we feel you're right at the edge, we would do a different technique, which leaves us room to go back and enhance you either within the year or down the road, as that other thing said. Does that answer that a little bit?
It does, thank you.
Yeah.
Now that thorough evaluation, is there a fee to that? Or
It's all included.
That's all included?
Everything's included, yeah. And with post-operative visits and enhancements up to a year if necessary.
Would you go over the cost of this procedure?
Sure. It's $2,200 per eye. That includes everything.
Everything?
Pre-op, post-op visits, and anything, if you need to be seen every day, if you're not doing well, it's all included, and it's all taken care of. You get our commitment to giving you a good result. And that includes, Saturday and Sunday and Christmas Eve if necessary. We're here, we're not going anywhere. So, I always like to tell the story of people who used to go up to Canada and have their LASIK done years ago because it was cheaper. And, most people did well, but there's some people who are going to have problems, and there's some people in this room may have a problem. But in Canada, when you have a problem and you call up, you don't get anybody because they're all gone. Here, you get somebody 24/7. That's why we're here. So, as a local practice, not only do we do LASIK surgery, we take care of people who hurt their eye, take care of people for contact lenses. We have all kinds of doctors here, all kinds of specialists. So you're getting a commitment to quality that you don't get when you head up to Montreal. So.
Why did people choose to go to Montreal?
It's cheaper. It's cheaper, and it's cheaper, and but the prices have come down. We're still way cheaper than it was 20 years ago, but we're proud of the fact that our prices represent the best quality laser you can get. You cannot go anywhere in the world and get higher quality than we have in our two machines. We have the state-of-the-art, the latest generation lasers on the flap side and on the correction side.
Are your, the tools that you use are made in here or made in another country?
The first laser is made in the United States. The second laser is made in Germany. And I have to say the Germans probably and the Swiss probably have the best optics in the world. Most of our examining equipment, unfortunately, is made in Switzerland and Germany. Just the way the world is, just the way the world is. But it's the most expensive and it's lasted forever. A lot of my equipment we've had for years. It doesn't wear out.
I have questions that are specific to me. If they don't apply to the group, you can take them offline if you want to. But I mean, I was born with a lazy eye, and my brain doesn't really use it anymore. If you correct my eye, am I going to be walking down the street sideways because my brain doesn't use it?
You want to take that or you want me to take it?
You can go ahead and take it.
Very interesting question. You won't be walking sideways. It's very interesting. We need to check your eyes. And the reason being is that if you've got a severely lazy eye, we probably will not recommend that you have laser surgery on your good eye. Okay? It depends on how bad your lazy eye is. And, you can have laser surgery on your good eye, but there is a very, very, very small risk of complications. And if anybody who tells you there's not, you should get up and leave, because anytime somebody puts anything in your body, whether it's a hypodermic needle for a flu vaccine or anything else, there's always a risk of something, okay? So depending on the level of laziness of your other eye, we may or may not recommend that you have this done, just because there's that infinitesimal little chance of a complication in your good eye, which we don't want to take, and you probably not want to take. So we'll, recommend that you don't have it if that's the case, but we'll see. We'll see.
Okay.
Yeah. Any other questions?
The problem with dry eye, is that temporary? Or is that?
Yeah, early on it is temporary. Most of our patients don't experience the dry eye symptoms early on. We do aggressively treat with artificial tears afterwards as well to make sure that it doesn't become an issue. In the patients where it becomes permanent, that's very rare in our practice that there's some issue with that. And like I said, that's because we have a rigorous screening process. If you have dry eyes before the procedure, we will not operate on you, because chances are it's just going to get worse after the procedure. It would be negligent of us to do that. If you do have dry eyes, then we can aggressively treat it. If you get to a stable condition, then we can go ahead and treat. Having said all of that, later in life, the eyes do become more dry over time. It could uncover some dryness, decades down the road. We haven't seen a whole heck of a lot of that. Again, I think we screen out the people that really shouldn't be done.
We also pre-treat you with nutritional supplements that are antioxidants that help you produce more tears and better quality tears. We use a nutritional supplement called Hydra Eye, which increases your tear production and improves the quality of your tear film. To be honest, everybody gets dryness after LASIK surgery. It doesn't matter who your surgeon is, what city in the world you have it. Everybody gets it because of the procedure. But in general, within a few months, you're using tears, and then you gradually just get off of them. And it's not been a real big problem for our patients. Like Dr. Vazan said, we do screen you for dry eye. We have a test that checks the amount of salt in your tears, which there's really very few practices that have that. It's brand new technology, and it tells us whether your tears are too salty. If your tears are too salty, probably means you have dry eye, and we want to treat you for that beforehand. So we do look to screen out every problem before we go ahead with this.
So, and that wouldn't be included in the price of the LASIK? That
It's
treatment
all included.
would be something different?
Well, the treatment would not be included because it takes several months to get you under control.
Yeah.
Your medical insurance would come in at that point.
Okay.
We treat you as a medical insurance, but the testing to figure that out is included. And if you go through all the testing, and we decide at the last test that you're not a candidate, you don't owe anything.
To what extent is the doctor's skill relevant? I mean, to what extent? I don't mean to be crass. I mean, in the past you had a blade, I assume,
Yep.
and a blade in a hand means someone's gonna put a blade in your eye.
Sure.
And here we have what I assume is a computer program firing lasers in your eye. To what extent is
The
the
doctor's
surgeon's
experience, I think, is crucial,
Okay.
okay? It's crucial before the surgery to recognize potential problems, and then it's crucial to have that experience during the surgery that as things are evolving. Surgery is not a static thing. It's not like taking 8 spark plugs out of your car and screwing in 8 spark plugs and you know everything's going to work fine. Things change dynamically. You have to have a surgeon who's experienced, who knows exactly what to do when a patient gets anxious, starts moving their eye, when to stop the laser, when to start the laser. There's thousands of brain cells firing and millions of brain cells firing in the surgeon's mind at the time of the procedure for that 1 minute or so that you have to get it right. And that's what you trust us to do for you. So to answer your question, there's a lot of skill. It's not just plug it in and to the computer and turn it on. Even though yes, the computer makes it safer and more accurate, the laser, there's still a lot to be done in terms of positioning and preparation and guiding everything along. And the nice thing about the bladeless laser is that if there's a problem during the creation of the flap, and there's a little comment in the video that talked about with the older technique, and some people still use this, with the bladed technique, those problems that occur are what led to problems with LASIK 20 years ago, and they can't be repaired easily. The nice thing about the laser is that if there's a problem where it doesn't fit your eye properly, if it doesn't give you a proper cut, as long as you haven't gone to the next stage, and that's why you know if your surgeon knows what he or she is doing, if he doesn't go on to the next stage, there's no harm done because the cut is microscopic. You just let it heal. You come back 3 months later, you can redo it again. There's no problem because the cut with the laser is so much finer than it is with the blade that there's no harm done, and it's just safer. It's just safer. When I grew up doing it with the bladed technique, and every time that blade would go across the eye, my coronary arteries would get a little bit smaller, and almost all the time it's fine. With this technique, you sit there and the level of calmness of myself is much better because I know, in worst case, it's not going to do any harm. So it does matter. Good question.
What if I flinch, or is the eye held open, or?
The Wavelight laser, you want to talk about the tracking device a little bit?
Yeah, sure. So, well, for one, your lids are held open with a speculum, so you won't be able to blink. We treat one eye at a time. The opposite eye is patched to protect it. The Wavelight laser actually has a tracking mechanism on it. So it will lock into your pupil, and then as your pupil moves around in small, what we call saccades, little movements, it will follow it in all directions and planes. If you move too far, the laser will actually shut off, and then it will pick up exactly where it left off. So there are a lot of fail-safe mechanisms built into this machine to make it as safe as possible and as good as possible.
The laser it takes a digital picture of your eye, and then 4,000 times a second, it compares in its memory where your eye is located versus where it thinks it's supposed to be. And if it's out of a range, it just instantly shuts itself off. I mean, way faster than I can even take my foot off the pedal.
Pretty cool.
It is cool. It's the same original software and tracking system that was developed for the missile defense system in the years of Ronald Reagan when he was the Star Wars program that he was developing. The tracking missiles coming into the United States had developed this tracking software. This is where this technology originated from. Anybody else?
Procedure done here in office?
It's done in our laser center in Nashua. All your pre-op evaluation is done here. The post-op appointments are here, but the actual surgery will be in Nashua.
Did you have it done?
Excuse me?
Did you have it done?
No. I don't have any correction, luckily.
I think we self-select as ophthalmologists. I never had it done. It's the only good part of my body. So I have perfect vision, so does Dr. Bazan. Yeah. You want your eye doctor to have perfect vision.
Yeah.
Any other questions? Sure.
Do you offer anything just prior to the procedure
Yeah.
to help you with nerves or anxiousness or anything?
We do give you some Valium to everybody. We give you some Valium beforehand, and we give you 2 to take home with you. Because the most important thing when you're done is go home and go to sleep. And just sleep for a few hours. Sleep is the best thing. Your eyes are closed. The initial healing takes place very quickly where the wound seals itself. So we want you to go home and sleep. And that's the best thing. Sleep is the best thing that first day. So yes, you do get some Valium.
I'm assuming you would need somebody to take you and drive you.
You
And
definitely need somebody to take you and drive you home. And then we also tell you to have a driver handy for the next morning. Most patients will see well the next day, but we want you to have somebody handy just in case you don't see so well.
Mhm.
I work on a computer most of the day, Any limitation of working the next day after the procedure?
No, most of my patients go back to work the very next day.
Some people go to work before they come see you.
Yeah, right. Yeah, they're eager to get out of here to get to work.
Exactly.
No, it's very rapid in terms of getting back to work and recovering.
Anybody else?
Let's go.
Okay.